Michael Harrington?
I just think that two things. One, to view freedom positively, I think people over 65 years of age in the United States today are freer now because of Medicare. I do not think that the freedom to die from the lack of medicine was a very good thing. Secondly, related to industrialists, I think that one of the startling things about American history is that when Franklin Roosevelt was saving the system from itself, the main beneficiaries were screaming bloody murder at him for being a traitor to his class, when he was in fact the salvation of that class. And I think therefore if you look at our history, I do think you find a tremendous myopia on the part of industrialists, and you find that the positive increments to our freedom, interestingly enough, have not come from the college graduates, but often from people with, not from the best people. It's come from working people. It's come from poor people. It's come from blacks and Hispanics and the like.
Milton, would you reply, but then tell us why you took us to Hong Kong to prove something?
Sure. Unaccustomed as I am to agreeing with Michael Harrington, I will agree in part with what he's just said. I do not believe it's proper to put the situation in terms of industrialists versus government. On the contrary, one of the reasons why I am in favor of less government is because when you have more government, industrialists take it over. And the two together form a coalition against the ordinary worker and the ordinary consumer. I think business is a wonderful institution, provided it has to face competition in the marketplace, and it can't get away with something except by producing a better product at a lower cost. And that's why I don't want government to step in and help the business community. Now, I want to go to your question about Medicare. There are many people who have benefited from Medicare, but you're not looking at the cost side. What has happened to the people who are paying for it? We don't have a free good. It isn't coming from nowhere. And are they benefiting from it in a cost-effective way? Those are the questions. It's demagoguery, if you'll pardon me, Michael Harrington, to say the people who have Medicare are freer. Of course, in one dimension. But they themselves have been paying all their lives. And have they gotten a good bargain? At the moment they have. The young men, the young working people who are going into Social Security now, they're going to get a very raw deal indeed.